didn't take too long. Thank you for staying with us and not disappearing. And you'll be very pleased to learn that we come to the final session of today. Thank you for your stamina. And thank you again to the Minister and to Mark for being here at the end of the day, now to close the day. And of course, you see here to my left this very beautiful outcome statement. The production, I think, very much an exercise in co-creation, a collaborative effort of many of you who are here with us today. Thank you so much for all your contributions, very rich contributions. Of course, we have tried to build on the original Tallinn Charter and echo the values of solidarity, equity, and participation. Also recognizing, even as Vesna was saying earlier, the fact that when we talk about health systems, we encompass both personal and population health services, as well as other activities to influence health policies and determinants of health. So in this outcome statement, we all together, you meeting participants with us, have sought to capture the spirit of this conference by re-emphasizing the role of trust and transformation. We've heard about the importance of engaging meaningfully with the public, with patients and with health workers in the design, implementation and operation of health systems to build and maintain trust as a key prerequisite for transformation. The statement, of course, very much reflects the reality of the context that we are working within and sends a clear message that health is intimately related to a well-being economy, to healthy environments, and that effective health systems are indeed a political choice to the extent that we can make political decisions that affect whether our health systems get the investment, get the resources or not. So, I think with this, I hand over now to Heli.
Yes, thank you, Natasha. It's a great honor from my side also to be here with all of you. And we invited to the stage already 4 persons. As you know, Dr. Mark Danson, who signed actually Tallinn Charter in 2008 as regional director of WHO Euro. So you will be the first one I would like to ask to go and sign the canvas, and if you would like to say some words why this is important for you, then it's your option.
First of all, it's very rewarding 15 years after to see that things have not been totally forgotten. Many of the things we do have no future. So 15 years later, you can see that the basis of what we did at that time, I say we because I was not the only, I signed, but a lot of people were working before, that what we signed, that what I signed, in fact is continuing and improving. Continuing because I want to go along with what Vesna said. You will not imagine at that time how much it was important for us to reconcile, to integrate different parts of public health that were split, different level of public health, different type of intervention, different even establishment of public health. I will tell you why. And at that time, what we heard, and I tell it the truth, primary health care is for poor. I hope Milita is there. Why do you push for something that is very low level? We were shocked. We heard also the good thing is hospital. The low primary health care is not the level. And in a way, you are unjust with the poor to push them to adopt this sort of thing. And I am a psychiatrist by training, and I heard that Mental health, no, it's not part of medicine. So at that time, it seemed totally mad, but at that time, there was no integration. Our basic idea was to try to integrate, to give to the politicians a tool to make a good health policy. I hope we succeeded, but at least it was a good idea and a good intention. So I want to finish by a word that Hans Kluge asked me to say. He feels very committed with what is written here, and he will do it together with those who are co-creators of health. I don't tell them one by one, but it was all those that were put in the speech this morning. So co-creation of health is different of health limited to a little number of people. So now I'm very happy to sign. Do you have a pen?
We have a pen. And you are the first one to sign, Mark. Bravo. Thank you. You have full choice. You can sign anywhere.
Thank you very much, Marcus. Great, really, to have you with us. And now I would like to
call to give a brief intervention and sign. Agu Laus, thank you very much for joining us. And Agu is an advocate for older persons and their health.
Thank you. Dear honorary guests, ladies and gentlemen, at first I would like to thank you very much for inviting me to participate here in very important conference. I am working as head of advocacy in the Golden League NGO, and in my initiative there was launched a network to protect elderly in Estonia. The network of 23 organizations is partner for the Ministry of Social Affairs in Estonia. And I am chairperson of this network. The network has compiled a document of principles of an age-friendly Estonia, where we express our wishes and hopes for Estonia to be more age-friendly society. Today, on the Tallinn Charter 15th Anniversary Health Systems Conference on Trust and Transformation, I confirm that as a network, we support the values of solidarity, equity, and social participation expressed during the conference here in Tallinn. And we will follow the values of in our everyday work today and in the future. Therefore, it's my pleasure and great honor to sign the conference statement. Thank you very much. Wow.
Thank you.
Thank you, Agu. Agu and Marilyn, who is also here, are representing Life Course, what is very important if we are talking about health and co-creation of health. Marilyn, I would like to ask you now to sign the canvas and also maybe say some words why this outcome document is important for you.
Dear ministers, ladies and gentlemen, I am an ambassador of children's rights and standing for the welfare of children and adolescents is something that is close to my heart. Children and adolescents need to be engaged actively to the process of health transformation. Health is a co-creation with different sectors and stakeholders, where people health and well-being should be in the center. In healthcare, it is crucial to communicate with the child, answering their questions and addressing their concerns, as it helps to build a trusting relationship and ensures the necessary support and understanding for the child. I signed a conference statement with the hope that this will lead all of us, including children, to the improved health and well-being in the future.
Thank you very much, Marilyn. And indeed, we hoped that symbolically we would show that health systems are really there for all of us throughout our life. And Minister Sikkut, it's now to you to say a few words and sign the outcome statement.
Thank you. And I'm truly happy that the Tallinn Charter has not lost its relevance over the 15 years, but rather becomes more and more important. And secondly, I think a small explanation is also needed because Estonia digitalizes everything. And we didn't move from paper-based outcome statement to a digital one that you can read in an app. It's larger than life outcome statement, but it's because we want real commitment. If you give a real signature to an actual outcome statement, I believe that you are more binded and more committed to actually achieving what we pledged today. Thank you.
One photo here, please. Thank you. So I think, thank you very much. And now we would like to start the process of being able to sign the outcome statement. I don't know if Stacy and Rachel are still in the room at the moment. I see Stacy there. So please come, Stacy, and be the first person to sign after the formal ceremony. Thank you for staying with us throughout the day. Heli, you worked very hard to lead on the outcome statement. So please, you sign, and I will sign after you.
My pleasure, thank you. And you?
Thank you. And now, here's the pen. The floor is yours. Take your selfie, ask Uka to take a lovely photo, and the day is closed. See you later at the reception, and see you tomorrow morning. Thank you so much.